We're now joined by their new majority leader, Congressman Eric Cantor. Congratulations, Congressman.
Thanks, George. Good morning.
Good morning. I know you spoke with President Obama yesterday, and we just heard from Jake Tapper about the possibility of these big staff changes at the White House as well. From what you're seeing and hearing from the White House, are you optimistic about bipartisan cooperation in 2011?
George, I am. Republicans come to Washington as a new majority looking to deliver results for the people of this country. And when I spoke to the president yesterday, I told him we are very interested in what he has to say in the next couple weeks, especially when he comes up here to deliver the State of the Union address. And I spoke to him specifically about the kinds of spending cuts that I hope he proposes in that address. I told him also that we'll be looking to see what type of ideas he's got for tax reform. The president acknowledged to me there's a lot of competition in this world, and our economy is faltering right now, and we've got to get back in our game so America can start winning again.
Of course, you'll also be looking to undo his signature legislative achievement from the last Congress, health care reform. First order of business is repeal. And yesterday, the outgoing House Speaker, Nancy Pelosi, really threw down the gauntlet in her speech, laying out the benefits Americans will get. She says Americans will get thanks to the passage of health reform. Take a look.
It means that children with pre-existing conditions can get care. Young people can stay on their parents' policy until they're 26. Pregnant women and breast and prostate cancer patients can no longer be thrown off their insurance. Our seniors are paying less for their medical prescriptions.
Do you think Americans really want to lose the benefits outlined by Nancy Pelosi?
Well, unlike the allegations that the former speaker made, George, in that address, Republicans do care about people having health care. And we just know there's a better way. And I think the election that occurred in the last couple months demonstrated the people of this country did not like the Obamacare bill. Neither do we Republicans. And that's why we're going to put a repeal bill across the floor next Wednesday so that we can send a signal that we're dead serious about getting rid of the spending of money we don't have and making sure that we stop the job-killing regulations that have followed up after the passage of that bill.
But if repeal were to pass, all those things that the former speaker laid out there would go away.
George, there is a better way, and part of the resolution that we're going to be voting on next week is going to instruct our committees and the members of Congress to deliberate in an expedited way as to how we can better provide an environment for access to health care for more Americans. We know that the Obamacare bill, it costs too much. It will provide the environment where people will lose the health care that they know, and that's not what Americans want. Republicans have always talked about a healthcare environment which you have more choice, which you can shop for insurance across state lines, where the emphasis is on the doctor-patient relationship, and we can provide some competition so we can bring down costs. That's what we Republicans are for. And again, I hope we can sort of dial back the partisan rhetoric that you heard from Nancy Pelosi and work together to deliver those results.
You mentioned you wanted to work with President Obama on spending cuts. In your pledge to America, you promised $100 billion in spending cuts in the first year. That now seems to be scaled back, according to various reports, to $50 or $60 billion. Can you pin that down right now? What is the target House Republicans are trying to meet this year in spending cuts? And can you lay out specifically how you're going to get there?
George, the target in the Pledge to America was to reduce discretionary non-defense spending down to 2008 levels. And that's what we're going to do.
But it said $100 billion several times in that document, Congressman. You know that.
The $100 billion was based on the fiscal year. And what happened, as you know, is when the Democrats ended the session last time, they didn't pass a budget. So we're in a situation where we have no budget right now, and we're going to work hard to bring spending down to 2008 levels. And whether that
What's the number?
Whether that happens, well, we are going to accomplish more than $100 billion in cuts over the term of this Congress. We are going to
But not the first year, as you promised.
George, what we promised was we're going to bring spending down to 2008 levels, okay? And I think all of us know that the sun rose and set in 2008. This is pre-bailout, pre-stimulus levels, so we can begin to return this country back to a path of fiscal sustainability so we can get people back to work.
Congressman, we're out of time. I just want to get a number. Is it 30, 40, or $50 billion?
George, I tell you, you won't give up. This is 2008 levels, George, and you know why the mess we're in again, is because there is no budget left from the Democrats during their majority, and we're working as quickly as we can to dispatch our committees so that we can identify the areas of savings. Everything's on the table so that we can start living within our means, just as every family and business person out there across this country is having to do each day.
Okay, Congressman, thanks very much for your time this morning, and again, congratulations.
Thank you, George.